Hello from WHO in Geneva. My name is Sarah Russell, and I'm going to be moderating our session this afternoon on WHO's first ever digital health guidelines. Before we start, it's fantastic to know that there are so many people taking part in this meeting by WebEx. But can I please ask you all to put your computers and phones on mute? Getting better? Okay, thanks very much. Okay, I'm now going to hand over to Dr. Oh, there's one person still there. Okay, I'm now going to ask Dr. Soumya Swaminathan, WHO's chief scientist, to open our discussion. I would also like to tell you that at the end of the presentation, if we can make it through without distraction on the WebEx, we will be opening up to questions from all of you. There are so many of you. Can you please send your questions in by WeChat, and my colleagues Ruel and Tegest will take the questions and pass them to the panel. We'll get through as many as we can. If we can't get through all of them, we will make sure that we get a response to you afterwards. Okay? People in the room, put your hands up, but you'll be taking your turn with the people on the web. Okay, thanks. Soumya.
Thank you. Good afternoon. Welcome to the launch of WHO's first digital health guidelines. As you know, digital technologies have sort of taken over all aspects of our life, health being one of them. And WHO has really been thinking about this now for a number of years and has put out from time to time different toolkits and other resources. But for the first time, we engaged in a guideline development process around some specific areas that Garrett will describe later. And this guideline is focused on those. It's going to be very difficult. WebEx participants, please could you mute? Please could you mute your phones? Thank you. Thank you. So, one of the reasons for developing this guideline also was that digital technologies have proliferated, and of course, countries are using them. So it's not that the things described in this guideline are not already in use. Many of them are, but there's also clearly many situations where ministries and countries are not well advised. They pick on wrong technologies, or they put them to use in ways which are not having positive impacts on health. So really the idea is to try to look at how do you use the tools in a way that is actually going to benefit the health system, benefit the health providers, but most importantly benefit the patients or the clients whose health you want to improve. There are some unique features about this guideline. Obviously, the space of digital health is very, very broad, and we're, as I said, this guideline only limits itself to those which can be disseminated using mobile phone technology in the absence of computers or tablets. And it also only looks at 10 interventions, and you can probably think of at least another 10 or 20 where there may be guidance needed. So this would be a living guideline, will be adapted from time to time, and will, based on the feedback that we receive from all of you and all the other users of this guideline, will attempt to improve it and to make it more user-friendly. And this is part of the general work that we're doing in our norms and standards department that's been recently set up under the science division, is really to make our guideline process more efficient, more relevant, more reliable, to be absolutely quality assured, and also importantly to take user feedback into the development, to do pilot testing, to make sure that it's in a form that it's easily used by people. So we hope that this guideline and others would also eventually be available as a mobile app, for example, that people could use even in remote areas. I want to thank the Guideline Development Group and the 28 members of that group who gave of their time and their expertise, as well as the internal WHO steering group. And this guideline was made by collaborating across 10 different departments of WHO. So it had very wide inputs into this. And also I want to thank our external reviewers. And last but not the least, I want to thank the donors who made this possible, the Norwegian Agency for Development Cooperation, NORAD, DFID, USAID, and of course the partnership, the special program for research and training in human reproductive health. Thank you.
Thank you, Soumya. And now we'd like to share with you a very short video statement from our boss, Dr. Tedros, who ever since he arrived at WHO nearly 2 years ago has been championing digital health. So here's Dr. Tedros.
Colleagues, distinguished guests, ladies and gentlemen, I'm delighted to welcome you to the launch of the first WHO guideline on digital interventions for health system strengthening. Digital technologies have dramatically changed the practice of healthcare and hold enormous promise for transforming the health of individuals and entire nations. With the proliferation of new technologies, there is an urgent need for evidence-based guidance on how to maximize the benefits of digital tools and avoid the potential harms. That's where WHO can play a key role. Our aim is to support countries to make wise decisions and investments based on the best evidence about how to prioritize, integrate, and regulate digital technologies. The WHO Digital Health Atlas is another tool for coordinating digital innovations and investments. Digital technologies are not a silver bullet, but they're important tools that countries can use to help make progress towards universal health coverage. As part of WHO's transformation, we have created a new department of digital health to provide the support countries are asking us for. We look forward to delivering more evidence-based tools like this guideline that can help to promote health, keep the world safe, and serve the vulnerable. I thank you.
Right. It's now my great pleasure to hand over to my colleague, Dr. Ian Askew, who's Director of the Reproductive Health and Research Department at WHO. Ian's going to give you some information about how these guidelines got developed and talk about some of the relevance of digital health for some broader health system strengthening issues. Thanks. Ian.
Thank you. It's good to see such a large turnout, both in person and over the phone systems as they're working so far. And I think this demonstrates the great interest in digital health that has been growing steadily. And as we heard, Dr. Tedros is really putting a strong emphasis on this. My department has been heavily involved in digital technology issues for many years now, and so it's been a great honour for us to be involved in developing the guidelines that are being launched today. Our work goes back several years, and we've been looking initially, because of our focus on reproductive health, on various aspects of digital health mechanisms and digital health technologies and applications that can be used with a primary focus on reproductive maternal sexual health. And we've been doing this in the broader context of the Global Strategy for Women's, Children's and Adolescents' Health, which has as one of its key components innovation, to try to make sure that, that interventions for women's, children and adolescents' health are able to be as widely available as possible and to reach the hardest to reach. And clearly, with the world developing in the way it is at the moment, and the way that digital interventions are such a central part to everyone's lives, we can't move forward in improving women's, children's and adolescents' health without a digital health approach or a digital health component. What we've also learned in developing the experience we have and the evidence that we've brought together is that this area of healthcare is not and should not be seen as only something for high-income countries. This is something which we're seeing across the world, and it's a critically important to take this into account when both looking at the ways in which the various technologies are developing, but also importantly how they can be used in different ways, whether it's a high-income setting, a low-income setting, for trying to reach people with real difficult access problems, reaching populations that are quite often perhaps marginalised or stigmatised. This is an approach to healthcare which really can go much, much further than even the best expectations of primary health care and community health approaches. It really is a radically different way of delivering health care. What we're finding is that, and I'm sure you've experienced this yourselves working in the health field, there are currently hundreds, if not thousands, of digital health interventions available across a wide gamut of health issues. What we did was to try to focus primarily on interventions that are being used in sexual, reproductive, maternal, child and adolescent health, but also trying to look at those from looking at what are the outcomes they were trying to achieve. And we identified 4 broad areas of outcomes that if you look at the digital health interventions that can be achieved. One of them, for example, is helping health systems to really collect real-time data and to process it, to have it available for managers, to be able to use it for performance monitoring and ultimately for accountability of health systems. Secondly, there's a whole area of digital health interventions that can focus on helping frontline health workers, as well as primary health workers and other health workers in the health system, but helping them to really work more efficiently, more effectively, to have the latest information at their fingertips, and to then help them to support client records, the way that they interact with their clients over time, and to be able to provide alerts to their clients when needing follow-up services or follow-up with medications. And that brings me to the third area. There's a lot of enterprising work being done around using digital technologies for tracking medical commodities, for making sure that stockouts ultimately become a thing of the past, that the medicines are in the right place at the right time and in the right quantity to be able to provide services at health facilities. Then fourthly, there's the area which is critically important as we move forward in trying to achieve universal health coverage, and that is making sure that essential health interventions are covering as many people as possible, that any barriers to access are reduced, and so the potential for universal health coverage is achieved. And fundamental to that as well, and you'll see in the guideline a significant attention paid to this, is the critical issue of recording vital events, recording births, recording deaths, as well as recording visits to health facilities and the health services received. So a wide variety of applications already that we've addressed in the guideline. As many of you will know, WHO has very stringent approaches for developing guidelines, and as acknowledged by Dr. Sumi, the Chief Scientist, the Guideline Development Group is a fundamental part of that. But we did follow to the letter the review procedures for developing WHO guidelines. And so the guideline that you have in front of you has been fully developed based on the strongest evidence available through doing various systematic reviews, compiling, grading the evidence, pulling together from various experts to get their opinions on what the recommendations should come to. I'd also like to highlight that, as Dr. Samia said, this is going to be a living guideline. In other words, we will update it regularly. Given the speed of change in this particular area, we won't wait, say, 3 or 5 years and then do a complete update. We will be updating it regularly, as often as we can with the resources available, depending as new evidence becomes available, either around new recommendations we should be making or adjusting and revising the existing recommendations. And finally, I want to point out that although this first version of the recommendation is primarily focused on sexual, reproductive, maternal, child and adolescent health issues, this is really just a pathfinder for health care across the whole gamut of health issues. And certainly the next versions that we see of the next iterations of this guideline will cover other areas of health interventions as well as continuing this focus on that area. So I'd just like to thank you all for being here. It's a great honour, as I said, for our department to be so centrally involved, but we also really appreciate and acknowledge the very close collaboration with numerous departments across WHO. And we're looking forward very much to working closely with the new Digital Health Department that Dr. Tedros has mentioned, and that will continue the work on leading this area for WHO as a whole. So with that, thank you.
Thank you, Ian, for that very helpful context. I'd now like to hand over to Garrett Mehl, who really is the hero this afternoon, along with to guest who's sitting behind her phone in the corner. They've devoted, I'm not quite sure how many, 2 years to this guideline? So now, to share the fruits of their labours, here's Garrett.
Thanks so much. Thanks to the panel, and also thanks to all of you in the room here, but also those who are joining over WebEx. We're really excited to be able to share part of the story of how we got here, but also, I think, the details, the meat of really what is in the guidelines themselves and how it's applicable to the work that you do in your own program areas, as well as in the area of achieving universal health coverage. I put up this slide. Those of you who are working in digital health may be familiar with it, but it is a slide of Uganda, and it reflects 2011, and it reflects these pockmarks of different digital innovations that were taking place in the countries. And while these were innovations and they were exciting, countries were aware of the fact, and they were looking for guidance as to which of these had value. And this slide, I think, kind of became part of the reason that we began the story of looking at the evidence base and beginning to develop these guidelines a few years back. Around the same time, in 2013, we started to see not only the innovations that were coming out of globally around the use of digital technology for across different program areas, we also started to see calls in the print publications looking for evidence and making sure that the evidence was there. In 2011, we ourselves launched a call to action for an improved evidence base in this area, and began to build and develop tools that would address this question of if e-health or digital health or m-health was used improperly, it could even cause harm. And so, therefore, implementation should and must be guided by evidence. So we needed to begin to develop tools that would help to, number one, collect better evidence and help those who were developing these innovations to also publish on that evidence, so that we would be in a position to be able to synthesize it and bring it into guidelines at WHO. The resolution last year in 2018 on digital health in the World Health Assembly reinforced this question that member states of WHO were requesting for more guidance and guidelines from WHO. So why a guideline? It begins to address the question of, does digital health work? And there have been many debates of, is this a worthwhile investment? Questions of, there are investments taking place, are these the right investments? And the fact that there has been a lack of guidance to plan and inform those investments has proved challenging. And so therefore, an official request came to WHO in 2016 and again in 2018 in the resolution. And thankfully, we had started work on the guidelines and synthesizing the evidence in order to get to the point of having something to present and have these recommendations for countries and partners. The Guideline Objectives focused on reviewing the evidence supporting digital health interventions in order to inform the decisions of country investment plans. Guidelines assume there is a choice in what you invest in, and they provide recommendations where there is an evidence base of these are stronger, these make a case for investing in areas where there is an evidence base. It also aimed to provide recommendations to ministries of health and partners on effectiveness, as well as issues of implementation considerations, and as well documenting the knowledge gaps in the research base. Why did we focus on accessibility via mobile? It isn't exclusive to mobile. It's a high bar we set to ensure that the entire global community could benefit from the use of digital interventions, and many countries have access to mobile phones. And so these recommendations don't preclude them, the interventions being used on tablets, computers, or other devices, but we wanted to set a high bar to say if it works on mobile, it will work on all these other devices as well. So this is about ensuring universal access to the use of digital technologies, and so the recommendations that I'll describe shortly are really on the basis of you could be deploying these through any digital device. It also assumes that there is an enabling environment. The ITU and WHO put together some guidance in this area around strategy and ensuring that the policy environment and the governance around that is in place. In the absence of that, it's very difficult to imagine a country successfully being able to nationally scale and ensure support to digital interventions. We looked, and if you think about these digital deployments, you think about three areas. One is the health content that lives on a digital system reflective of the recommendations and best practices that WHO puts out in medical guidance? The second question is, does the functionality that's available, does that actually add value? Does that strengthen over and above what's already there? And the last is the software or the digital application that's being used an appropriate software that would reach national scale? We focused on the second question, which is the functionality, recognizing these other two are critical to successful implementation. And that second question is, does the ICT capability or the digital intervention contribute benefits or harms to health sector needs? We also wanted to look at this question of health system strengthening. And so in the context of ensuring that countries ensuring that they're trying to get effective coverage of interventions like vaccinations or antenatal care visits or diabetes management. Those are health interventions that have been validated. These digital interventions are about augmenting and improving and overcoming the problems that countries face in achieving high coverage, high quality of deployment of those interventions. We ensured that we were looking at all different layers of the health system, from the points of accountability to the supply, to the demand and the quality and the affordability issues. So the recommendations at each of these different layers that are really very important for the universal health coverage goals. When we started scoping this, we identified 88 different functions in digital health and developed a classification scheme, and we focused on 10 different interventions. or 9 different interventions that became 10 different recommendations. But what's important here is that there's a lot of digital health. I think Ian noted there's a lot of digital health going on, but this focus of these guideline recommendations are really about the bread and butter of what, at a minimum, should a country be thinking about. And we focused on digital interventions for clients, for health providers, as well as managers. The guideline process, I think, has been described previously, but it's probably important to note that we put it out for public comment, and the questions that are the focus of the evidence synthesis were those that were compiled from the prioritized areas of the global health community. We identified those questions, we retrieved the evidence, we assessed and synthesized it, and then we brought it together to a panel of experts who then developed recommendations, and those recommendations are then compiled in the guideline. But to get to that point of a recommendation, they have to consider the criteria of accessibility, functionality, as well as equity and acceptability, as well as the evidence of effect. And they took those considerations and they brought them together in the form of a recommendation. So the guideline itself, I'm not sure whether they're being passed around yet, but there are copies of the guideline, which is just hot off the press. We have included each of the recommendations in sort of a life cycle of how they may be used. And I'll go through each of those sequentially. Birth and death notification. So that's notifying of a birth and notifying of a death. And in this case, it enables health workers to be more proactive in identifying pregnancies and coordinating emergency services. There are concerns, however, with death notifications, and so the recommendations specific to that are notably in the form of a research study. But birth notifications via mobile devices are a recommendation, and under the conditions of in settings where the notifications provide individual level data to the health system and or civil registration and vital statistics system, and the health system and CRVS system has the capacity to respond to the notifications. If a notification for birth is being made, there should be a response from the health system. So ensuring that those implementation considerations are made is part of the recommendation. The sensitivity around death notification was acknowledged in the guideline, and so therefore the recommendation here is to implement these, but only in the context of a research study to understand their value and the sensitivities around deployment. We also looked at the use of digital interventions for stock notification and commodity management. This, of course, is used to ensure stock availability and by health workers to anticipate stock shortages to be able to then have that data visibility and act on it and ensure that the stock is ensured that it's made available. WHO recommends the use of stock notification and commodity management via mobile devices in settings where supply chain management systems, again, have the capacity to respond in a timely and appropriate manner to the notifications. You'll see the consistent approach of digital is a way of augmenting the health system, and if the health system isn't able to respond, there will be failure. So you need to be able to look to see to what extent those implementation considerations are taken into account, and then it can amplify and improve the traditional service provision and other services the health system is providing. We also looked at client-to-provider telemedicine and the use of digital interventions, and we found that it does improve outcomes, such as unnecessary clinical visits, reduced mortality among individuals with heart-related conditions, exclusive breastfeeding, and increase the health-related quality of life in that 6-month period after the intervention. There are a lot of different factors here that I would encourage you to look through in the guideline. I won't go through each of them here, but let's note that the recommendation from WHO recommends client-to-provider telemedicine under the conditions that it complements rather than replaces face-to-face delivery of health services, and in settings where patient safety, privacy, traceability, accountability, and security can be monitored. We also looked at provider-to-provider telemedicine, and found that it may improve health worker performance, reduce the time for clients to receive appropriate care or follow-up, and decrease length of stay among individuals visiting the emergency department. There were weaknesses in other parts of the evidence base, however. WHO recommends provider-to-provider telemedicine in settings where patient safety, privacy, traceability, accountability, and security can be monitored. We looked at targeted client communication, specifically related to reproductive health, RM and CAH, actually, and there were positive effects on outcomes such as oral contraceptive, use by adolescents, adherence to antiretroviral medications, and HIV appointments among exposed children. But there may be little to no evidence of outcomes in other areas. And there are some unintended negative consequences for areas where there's a sensitivity in the content that's being delivered. So again, those considerations around implementation are very important. WHO recommends targeted client communication via mobile devices for behavior change regarding sexual, reproductive, maternal, newborn, child, and adolescent health, or child health, under the condition that concerns about sensitive content and data privacy are adequately addressed. In an update to the guideline that we're working on now, we'll also be looking at targeted client communication for NCDs with our colleagues in other departments. We also looked at health worker decision support, and there are positive effects on individuals taking prescribed medication, but there may be little to no difference in other areas. The health workers found this approach useful and reassuring for guiding delivery of care, but some workers perceive the algorithms as too prescriptive. WHO recommends the use of health worker decision support via mobile devices in the context of tasks that are already defined as within the scope of practice for these health workers. Digital tracking. Digital tracking and decision support may improve outcomes such as attendance of antenatal care appointments, immediate breastfeeding, receipt of the third dose of polio vaccine, and use of postpartum contraceptives 6 months after birth. There are other areas where there were gaps in the evidence base. WHO recommends the use of digital tracking with decision support under these conditions in settings where the health system can support the implementation of these intervention components in an integrated manner and for tasks that are already defined as within the scope of practice for the health worker. We also looked at digital tracking combined with decision support and targeted client communication. WHO recommends the use of digital tracking combined with both decision support and targeted client communication under these conditions in settings where the health system can support the implementation of these intervention components in an integrated manner and for tasks that are already defined as within the scope of practice for the health worker and where potential concerns about data privacy and transmitting sensitive content to clients can be addressed. We also looked at M-learning, so the delivery of information content for health workers to improve their knowledge, and found that the evidence was encouraging around increasing the health workers' knowledge. Health workers also appreciated the ease and portability of accessing materials and the ability to personalize the content to their own needs. There was concern about where the information was coming from, and so ensuring validity and accuracy of that content is critical. WHO recommends digital provision of training and educational content for health workers via mobile devices and learning under the condition that it complements rather than replaces traditional methods of delivering continued health education and in-service training. These 10 recommendations are consolidated into this life cycle of how it may be used within the health system to achieve universal health coverage. Digital interventions, to summarize, digital interventions have modest benefits in some areas, but limitations in what they may address. There's a clear vision of need that needs to be established, and the investments need to directly be linked to those needs. And investments can be combined to achieve quality, coverage, and affordability. ensuring that this enabling environment, the policy, the governance, the infrastructure, the standards, the things that are behind the scenes that are critically important for this can determine the viability and potential impact of these interventions. Documentation and coordination of digital investments is critical to success, and it should be noted that leveraging mature software global goods should be used where possible. It's important, this guideline is really a cautionary note that digital health can have effect if it's used responsibly, and understanding the challenges that you're trying to overcome and ensuring that it adds value to the user. WHO has developed the Digital Health Atlas as a way for governments and stakeholders across the community to register and understand what the interventions are, but also to understand whether or not they line up with WHO recommended guidelines. Lastly, the guideline itself includes a lot of additional information. It's roughly 200 pages. It includes implementation considerations for each intervention, overall implementation considerations aligned to the ITU and WHO eHealth Strategy Toolkit that many of you should be familiar with, and an evidence map and research gaps for future consideration. There were considerable areas of evidence gap, and I think this is suggestive of a call to action in this area. I just want to acknowledge the kind support that different agencies, including Norwegian Institute of Public Health, the Guidelines Development Group, the WHO Steering Group, external reviewers and Cochrane Response and Systematic Review teams, as well as the funders, DFID, NORAD, USAID, and HRP. Thanks very much.
Thank you, Garrett. You've given us all a lot to think about. And apologies for any of those of you who weren't able to catch everything that Garrett said on the WebEx. We clearly have a few improvements to make on our own digital presence here in WHO. I hope, however, you were all able to see the PowerPoint. I would now like to hand over to maybe actually, as we've all had a lot to take in, to listen to 7 people who've contributed comments by video about what they see these guidelines producing and their value for public health. We'll start with Professor Alain Labrique, who's Director of the Johns Hopkins University Global mHealth Initiative.
Greetings from Baltimore, Maryland. My name is Alain Labrique, and I'm a professor at the Johns Hopkins University Bloomberg School of Public Health and director of the Global mHealth Initiative. Our center supports digital health, research, innovation, and implementation around the globe. Our team is proud to have walked alongside WHO in its digital health journey. True to its mission, WHO's investments in innovation have focused on appropriate technology and pragmatic evidence-based recommendations. Member states look to WHO to recommend best practices, and in a field filled with hype and shiny objects, it's been an honor to stand alongside WHO colleagues and advocate for scientific rigor. These guidelines are more than a milestone for this field. They provide a roadmap for research and a call for more high-quality evidence. They are also an inspiration to implementers to use digital health strategies to solve persistent health system problems on the road to universal health coverage. Congratulations and thanks to everyone who made this possible.
Hello, my name is Pascal Alote. I'm the director at the United Nations University International Institute for Global Health and the co-chair of the Guidelines Development Group for Digital Technologies. There's a lot of excitement around the potential of digital technologies in improving access to health and training and the quality of diagnostics, care, and the management of disease. But developments have been rapid and the quality of the evidence of what works is not always clear. The downside is therefore a risk of exacerbating inequalities. That's why I am delighted, as the co-chair of the Guidelines Development Group for Digital Health Technologies, to finally see the release of these guidelines. These are timely, rigorous, and an important first step in what will be an ongoing process. My sincere congratulations to HRP and to WHO.
Excellencies, ladies and gentlemen, in my capacity as the President of the Commonwealth Medical Association and the Chairman of the Commonwealth Centre for Digital Health, it gives me great pleasure to congratulate the World Health Organization on the release of the World Health Organization's first ever digital health guidelines. Having been intimately involved in the process of scoping and developing these guidelines, we understand well the implications that they have for our countries and territories. It will help them make the correct investment decisions in deploying digital health technologies, as well as help them make the correct investment decisions in developing digital health skills. These are two focus areas for us. These guidelines will help strengthen our work. We look forward to working with the World Health Organization to mainstream these recommendations through our work. Thank you.
Hi, my name is Adele Wogman, and I'm Senior Digital Health Advisor in USAID's Global Health Bureau. USAID is delighted to welcome the WHO Digital Health Guidelines as an important step towards strengthening country health systems. Digital technologies have great potential. They can increase the access to, accuracy of, and analysis of health data at all levels of the health system. This potential is perhaps our greatest opportunity for reaching our shared global health goals, and the guidelines will help us understand how to leverage digital technologies in a way that is effective, sustainable, and responsible. USAID will use the digital health guidelines to support our partner countries in developing robust national plans that effectively leverage digital technologies to reach nationally identified health priorities. We recognize that digital technologies on their own are no silver bullet, and that any use of digital technologies requires careful consideration of and support to a country's enabling environment, including leadership and governance, strategies, architecture, where possible the use of global goods, and many other factors. We thank WHO for taking this important work forward, and we look forward to using these guidelines in our activities. Thank you.
My name is Uman John. I'm a physician researcher from the George Institute for Global Health, India. Health systems across the globe are facing a number of systemic challenges in their pursuit towards health for all. Digital health interventions present an opportunity to address some of this health system constraint in achieving universal health coverage. So much so that digital health has been labeled as a penicillin of the modern era. Clinicians rely on culture and sensitivity patterns to choose appropriate antibiotics. As with antimicrobials, the effectiveness of digital health will be nullified if used as a broad spectrum intervention. The WHO Digital Health Guidelines are the culture and sensitivity framework for decision makers in the health ecosystem. India is a hub for digital health innovations. However, very few of these digital health innovations have achieved scale for impact within the health systems. It is important, therefore, to pause, reflect, and use the WHO Digital Health Guidelines as a framework to the innovation ecosystem in India and help guide the energy and enthusiasm of the startups to develop, evaluate, and implement digital health innovations that can help achieve universal health coverage.
Hello, my name is Olashopo Oyedepo, and I am the director of the African Alliance of Digital Health Networks. I also happen to be the project director of the Health Strategy and Delivery Foundation's ICT for Health project in Nigeria. Like everyone else, I'm quite excited at the launch of the WHO Guidelines on Digital Health Interventions. I see these guidelines providing guidance and support for policymakers, program managers, and implementers in Nigeria and globally as they make investment decisions regarding the use of digital technologies on their journey to attain universal health coverage. I do believe the guidelines provide a basis for us all globally to be guided by the same ideals and understanding as we embark on our various digital health initiatives. The African Alliance and our partners pledge to join the World Health Organization and other stakeholders in encouraging, facilitating, and supporting the use of these guidelines as part of regular, everyday decision-making on digital health investments. Congratulations to us all.
Hello, I'm Dr. Fazila Alauddin from Ministry of Health Malaysia. I'm delighted to share the news of the launch of the WHO Guideline on Digital Interventions for Health System Strengthening. As the Deputy Director of Planning, I oversee investments related to digital health for national priorities. Additionally, as a council member of the Asian eHealth Information Network, I strive to ensure the responsible use of digital technologies and make sure our limited resources are being used wisely. This guideline, driven by evidence-based process, is instrumental in helping us make informed decisions about emerging digital health interventions and understanding the various nuances that affect implementations. We have the responsibility to make sure these digital tools are leading towards positive impact on our people's health and that they are enabling our health system to be more responsive and efficient. However, the work does not stop here. As this field evolves, we will need to continue to be critical and push ourselves to maximize the value of the investments we make. Thank you.
So, a clear endorsement of this area of work from around the world. Congratulations to the team involved. It's fantastic to see so many people out there and hear so many people out there who are really engaged in this area of work. I think it'll be particularly encouraging to my next speaker, and you'll be glad to hear our last speaker, Bernardo Mariano, who's the Chief Information Officer at WHO, and he's going to tell you a bit more about the future of WHO's digital health work.
Thank you. Perhaps I'll just want to start by saying that digital health, what we call today digital health, it is indeed the future of healthcare, business as usual. Maybe 5 years from now, maybe earlier, or maybe 10 years from now. The same way like in any other sector that went through digital transformation, we want to make sure that as we embark on this journey that started many years ago, and as we take that big leap on the digital health technology, we do it making sure that it is people-centric, it delivers positive health outcomes, does not harm people, and it actually improves the healthcare system as a whole. In the Department of Digital Health, which I'm working with Dr. Sumia to establish, there are 3 areas of that department that we will structure in a way to look into the following. One, we want to make sure that the policymakers have tools, knowledge, capacity to ensure that they play the role they need to play, both on the regulatory framework but also on the strategic framework in terms of policies, implementations, and prioritization, to really reap the benefits of digital health technology. On the other side, we want practitioners, as well as producers, to ensure that the tools and systems that we are introducing, or the world is introducing through the innovation in digital health technologies, those tools and systems, they are used well. People, of the practitioners that they use, they are well trained to use it to really enhance those benefits that we expect them to bring. On the third part, on the last part, we want people and partners. But let's talk about people first. That any technology on health needs to be people-centric. So the people's benefits, behavior change, and the impact or the evidence of impact on the well-being of the people, it's not left unattended. So it has to be people-centric. So the department will have 3 main functions. One will be the governance and the strategy, really to work with policymakers on the first P. The other one is health technologies, to work with the producers, practitioners on the second P. And the third one is capacity building and collaboration to really look at the people's impact and partnerships. So what we want at the country level, to make sure that all the technologies or digital interventions are aligned with the country needs. They are people-centric, and the maturity of the technology is sufficient enough to deliver those positive health outcomes. Thank you.